Hi, it's Dr. Pauline again. This is my third part in the series on antidepressants, and today I'm going to talk a little bit about side effects. So you're probably expecting me to talk about things like bowel problems, or maybe that you gained weight, or you lost weight, or it changed something with your metabolic system, and all of that can happen. But really, I'm going to talk about the long-term side effects of using an antidepressant on mood stabilization. So what we all have is what we call a baseline for our mood. And when we're having a good day, we might be up a little bit, we might be down a little bit, but we just all tend to turn to that baseline. And we all have our own sort of variation of how high or how low we get. So what happens is we're depressed, so we're down, 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 and we go and we take an antidepressant. What all of the studies have shown is, remember, nobody had a chemical imbalance before they started to take an antidepressant. Now we have a chemical imbalance because we've introduced this drug. And part of what we see is instead of just now I'm hanging out at depression, it actually can start to trigger manic episodes. After you start to take the antidepressant, you're now not only depressed, but you will have manic rebound episodes. So then you're given a new diagnosis, and now all of a sudden, oh, you're not just depressed anymore, now you're bipolar. So now that you're bipolar, we have to give you other drugs with your antidepressant to try to control the manic side of things. So you're in this weird chemical cycle. And what will happen with this cycle is most people, and it is called a bipolar cycle, they cycle up and they cycle down, and you will find that you have a pattern initially of, oh, maybe I have a month in between or 3 months between these manic episodes, and I'm trying to stay out of the depression side. So remember last week I talked about trying to dump that serotonin into the presynaptic cleft? Well, what's happening is your body is looking for that, and so we have to increase things. We increase it, now we're getting manic for a while. What ends up happening is that your cycle rates that may have been a month or 2 or 3 apart, which you now have bipolar because you took antidepressants, not because you actually had a chemical imbalance to begin with, but the cycling starts to have closer and closer cycling. So now the cycles are closer together. The other thing that you start to see is that you go higher and lower and higher and lower and higher and lower. And now we're talking about cycles sometimes occurring within hours of each other. So I'm cycling up, I'm cycling down, I'm cycling up, I'm cycling down. And that will really make for you feeling absolutely crazy because you don't know what's going on and it's happening so fast. And why can't I get balance? And it's because you got into the drug cycle really more than anything else. So keep in mind, I'm not telling you if you're on an antidepressant to stop today. I just want you to understand the mechanism for 2 reasons. One is if a doctor is recommending it, be very, very, very careful. It should only be introduced in the most severe cases of depression and only for a short period of time. Outcome studies have shown that if you use it for 2 to 4 weeks and you're getting psychosocial help as well, that can be effective. But once you get past that 4 to 8 week period of time, it's no longer effective in the way that we want it to be, and it starts to create all these other side effects, basically, and outcomes. And then all of a sudden it's like, oh, I was just depressed, but now I'm bipolar, and then I'm having anxiety attacks, and now I'm acting like a schizoaffective, and all these other things start to happen. So keep in mind the main side effect, even though you can have other physiological side effects, the main side effect is it actually creates a lifelong mental health patient. So next week, I'm going to talk to you again. I'm going to talk to you about that long-term use and what we actually see happening in the studies.